cholesterol is a waxy substance that we get from our liver and also from the food that we eat. The interesting thing about cholesterol is that everyone associates it with something being always bad, but in fact, cholesterol has really important uses. We need it to build cells, we need it to make certain hormones in our body. It's really crucial for a lot of our body processes. There are two different types of cholesterol: LDL cholesterol, or low-density lipoprotein cholesterol, which is bad cholesterol, and good cholesterol, or high-density lipoprotein cholesterol. HDL cholesterol is very important because it helps clear bad cholesterol, and it's helpful to build the important, cell walls and hormones in your body. So for the most part, if your HDL cholesterol is very high, we're very happy with that. Low-density lipoprotein, on the other hand, is bad cholesterol, and that's the cholesterol that your doctor is going to watch very carefully to make sure that it's at the right level to prevent you from having stroke and heart attack and heart disease in your future. Bad cholesterol, or LDL cholesterol, is the type of cholesterol that we hear about in the news, or you hear about from your friends or colleagues when they say that they have atherosclerosis. And atherosclerosis is when cholesterol, which is this waxy substance, forms plaque and starts to stick to the sides of your arteries. And when that happens, the arteries become narrowed and blood doesn't flow through them as well. And this is really particularly harmful to the heart, but it can also be harmful to the brain or to the vessels in your legs as well. So when one of these plaques made by waxy LDL cholesterol breaks or ruptures, that's when we see someone have a heart attack or a stroke, because a clot forms to try to repair that plaque rupture, and then people are in really serious trouble with emergency situations like heart attack or stroke. The one great thing about cholesterol is that medicine has come a long way in the treatment of cholesterol, and we have really great ways to lower people's cholesterol. And we know that if we lower your bad cholesterol, your risk of serious cardiovascular diseases is dramatically reduced. And this is true for people who've never had a heart attack or a stroke, and for people who've already had a heart attack and a stroke. So when you know your risk factors, you can treat your risk factors. And we think that this is the most important thing for patients, is to feel empowered by this and to know that there's something they can do to change it.